Is schizophrenia a mental disorder, or is it a fear response to perceptions that are less readily available to your average, exceedingly desensitized individual? I don't know. I was trained as a clinical psychology doctorate student to conceptualize schizophrenia as an actual, accurate clinical disorder with a growing body of scientific evidence that supports the validity and reliability of this diagnosis. However, it has been shown to be something different than the genetic underlying predisposition for mental illness in general. So is it something different altogether? So it's curious. Maybe it is. Maybe it's not a disorder at all. Maybe clinical psychologists and medical health professionals are pathologizing that which they do not understand, because the experiences the so-called schizophrenic is describing deviate so wildly, so drastically from anything the health professional or psychologist or psychiatrist has ever experienced. Perhaps then it is a tendency to say, all right, this is a major problem because it's something so far outside of the realm of what the person has experienced, what the person has talked about. And this other categorization or explanation, it's a lot easier to swallow than, hey, this is a person experiencing something that I don't get. Because with this diagnosis, we can then treat it and fix it and medicate the person, because that is the first line treatment for someone with psychotic symptoms. The first line treatment is antipsychotics, is pharmaceuticals, is medication for management of symptoms. And this is seen as a chronic disorder, something that someone never gets over. So my question again is the person having an experience that anyone can have that is scaring them enough so that they're going into the hospital? So they're having auditory hallucinations, they're hearing voices that are scaring them. So they're running to the hospital, to the ER, because the voice is telling them to kill themselves. This could be a very scary experience. I imagine it's incredibly unnerving, incredibly terrifying even, to hear a voice you cannot recognize as your own internal voice telling you to harm yourself. Now that would be extremely painful and terrifying. And so I do not blame anyone whatsoever or seek to make someone who's had that experience and run to the hospital and called 911 or called whomever feel bad about this choice, okay? That's a perfectly valid emotion. All emotions are, alright? Having fear has been very important to the survival of the human species, as well as all other conscious, sentient animal species on this earth. So having that fear response, nothing wrong with that, okay? My question is that the most useful way to look at and to treat schizophrenia or psychotic behavior? Are there other possibilities? And I think the answer is yes. I think that we are all infinite beings, capable of perceiving beyond the five senses, capable of perceiving beyond what is within the normal range. That I think as a species, in at least westernized, more civilized, developed culture, we are not readily having these kinds of perceptions. We're not readily hearing voices that we can't recognize as ourselves. We're not readily seeing things. There's a certain range of beliefs, right, that are okay, that are acceptable, that are normal. And there are beliefs that are called delusions. All right? And the distinction between the two is arbitrary. Someone's drawing a line. And that line, again, does not exist in nature. It is not absolute. It is not fact. It's not, if you're on one side of the line, you're wrong. If you're on one side of the line, you're right. If you're on one side of the line, you're sick. If you're on one side of the line, you're healthy. You're normal, right? That's not so, okay? As I've been learning more and more about spiritual awakenings and the nature of spirit, source, the universe, God, that which we cannot understand with mind, it seems possible, if not probable, that what is being labeled as psychotic symptoms can very well be symptoms of a spiritual awakening, signs that a person is connecting to beings or information, sensory information that is not readily accessible to your average person who's experiencing three-dimensional reality, okay? It's outside the realm of normal experience. I'll give you that. It's outside the realm of your average experience. But is running to the ER or the clinical psychologist or health professional your only option? No, I don't think so. I think working with a spiritual counselor of some sort can be useful and can give a different perspective on what it is you're experiencing. Of course, make sure your life is not in jeopardy. You know, if you're harm to yourself, please get in touch with a loved person who has your best interests at heart. Okay? And if you're a loved one who has a so-called psychotic family member, really seek to understand their experience and maybe try on some alternative perspectives, as if you and your loved one are not liking the whole course of traditional psychological treatment for a psychotic disorder. There may be alternative explanations and treatment, at least understandings that are out there that you may find useful, helpful, and actually quite positive. So it may not be necessary to put this whole pathological negative spin and plan on taking these medications, which are very much debilitating, desensitizing, zombieifying. Not that that's a word, but really can take the life and the spirit out of an otherwise creative, wonderful, infinite, capable, intelligent individual, okay? This could set you up for a life of mediocrity where you're never able to really find what it is you're meant to do, maybe never able to create that which you're meant to create, or to have children, or whatever it is that you want to do. These drugs may limit you from that. Again, for some people, they may be really useful, and for the people it's really useful for, keep on keeping on, okay? This video is intended for people who may be less satisfied and who don't want to choose that path, which, again, it's just one of infinitely many paths. So I encourage you to think about what you're experiencing from a little bit of a different perspective, and to know that there are other options, other explanations for what you're experiencing that do not pathologize your experience. Okay? Much love to you.